Hello, my name is Kelly Patterson. I am the clinical nutrition educator here at OmegaQuant, and I am going to be going over our vitamin B12 test. Let's go ahead and get started. So our vitamin B12 test was launched last year, and I'm going to be discussing the pathophysiology of vitamin B12 and its impact on overall health, talk a little bit about our test and how we can impact vitamin B12 levels to get them to where we'd like them to be. So vitamin B12 is a water-soluble vitamin, and it is synthesized through bacterial fermentation. And so towards the end, we'll be discussing about how we can impact vitamin B12 levels through our diet. And one thing you'll notice is that primarily vitamin B12 is synthesized by animals and animal products. And this is because of the bacterial fermentation that happens in different animals. And so this is how vitamin B12 is synthesized. Vitamin B12 is a really complex molecule and it can't be synthesized by humans. We are one of the animals that do not make our own B12, and we must get it through our diet. It is an essential vitamin, so we must get it through, consume it through our diet. This is the vitamin B12 molecule. As you can see, it's a very complex molecule. It's a large molecule, and so obtaining it through our diet is the most efficient way to get it into our systems. And vitamin B12 contains cobalt, and it has to be converted into different forms in order to be used and be metabolically active. So when we eat and consume foods that have vitamin B12 in them, a lot of processes have to occur in order for our body to metabolize and utilize that B12. So in humans, B12 is primarily absorbed in the small intestine, but first it has to be freed of a bound protein in the stomach. So when B12 is consumed, there is an enzymatic reaction that occurs in our saliva that allows a certain protein to be attached to B12. That then travels to our stomach where something called intrinsic factor is attached to the B12 molecule, where that protein that was absorbed or that was connected in our mouths is cleaved, and intrinsic factor allows the transportation and absorption of B12 from the stomach down into our small intestines and allows for absorption into the blood. B12 enters circulation in about 3 to 4 hours after ingestion. And about 25% of it is used by our cells pretty immediately, is taken up to do things like DNA synthesis and go through several different reactions. But the remainder is stored in the liver, and the liver storage is a really important aspect of B12 metabolism, because although B12 can be stored in the liver and released in the liver, our intakes and the B12 release from the liver can often be inadequate. And so that can lead to a lot of insufficiencies and deficiencies. And any excess B12, similar to all water-soluble vitamins, is excreted in the urine. So if you're taking in too much, more than your stomach and intestines can absorb at any one time, it travels through the rest of your digestive system, is absorbed in your bloodstream and filtered out by your kidneys and excreted in urine. So why do we care so much about B12 levels? B12 is a really, really important vitamin, and it's also one that is fairly common to not be taking in enough of. So in rare cases, but in the most serious cases, we can see something called megaloblastic anemia. And essentially, because of how B12 is involved in the production of DNA and DNA synthesis, megaloblastic anemia means red blood cells that are poorly formed due to impaired DNA synthesis. Red blood cells are constantly remade. We're making red blood cells every several months. The lifespan of a red blood cell is about 3 months. And so, that DNA is needed in order to have the blueprints of tell our systems what to do in making those red blood cells. So that's the biggest and probably one of the most serious side effects of a chronic long-term B12 deficiency is something called megaloblastic anemia. This can also be related to things like folate deficiency as well too, because of the inability to convert some of that B12. Um, Other things we can see in B12 deficiency are things like cognitive function and diminishment and dementia. This is a result of demyelination. So myelin is the covering of nerve fibers, the coating on the outside. And because of the impaired DNA synthesis, we aren't making any new myelin sheaths for our nerve fibers. And so the demyelination of nerve fibers can happen because of the inadequate B12 being taken in. Pregnancy is a really, really, really important time to make sure you're getting enough of vitamin B12. There's a big increase in risk for neural tube defects. So things like cerebral palsy can come from having inadequate B12. We hear a lot about folate and folic acid in pregnancy relating to neural tube defects. And while that is absolutely true, there's also a relationship with B12 because B12 and folate are really kind of hand in hand when it comes to the development of our nervous system. There's also some evidence to show that suboptimal B12 intake may contribute to infertility. Again, most likely because of that DNA synthesis and what we're dealing with when it comes to fertilization and pregnancy. So having a suboptimal B12 level, even not quite being in deficiency, may contribute to infertility. So it's definitely something that if you're having trouble with getting pregnant, fertility issues, checking out your B12 levels, just one more thing to take a look at. And then as far as gastrointestinal symptoms, you can see things like sore tongue, constipation, and appetite loss in people who have a more severe B12 deficiency. So these are just some of the things that can happen when you don't have enough B12 being absorbed into your system over a long period of time. So what's true also is that we tend to see B12 insufficiency. So when we talk about a B12 insufficiency, we mean being in what we would consider a low normal range, especially on a serum test. So at the bottom there, up to about 300 to 350 nanograms per liter is what we would call being in the low normal range. And this is where we would see insufficiencies. So a true deficiency would be well below that clinical normal range for a long period of time or for really any period of time. Insufficiency would be in that kind of low normal range, or what would appear being in that low normal range on a serum B12 test. And insufficiency is a lot more common than a true deficiency. And oftentimes, especially in older populations, insufficiencies are mistaken for other symptoms and kind of chalked up to things just like old age or other things that may be out of our control. So insufficiency is often missed due to serum testing. So a lot of the times when providers want to test a B12 level, they're looking at a serum cobalamin level. They're looking at serum B12 and they see that someone is in the low normal range, but they're within the normal range. And so they may say, well, you're within normal, your B12 is fine. These other symptoms may just be you're just getting older. So things like cognitive impairment, as I mentioned on the previous slide, can be often chalked up just to old age or something that we can't do anything about. GI disturbances, especially things like constipation, can be, again, chalked up to we're getting older, not as active, maybe dietary changes, things like that can often be, attributed to just getting older. And that's why insufficiency, not getting enough B12 in the diet, even if our serum levels look to be within a normal range, is often missed because if we're going by clinical symptoms, those can be attributed to a lot of other conditions, especially in a population of older adults. That's where that's most likely to be seen. So how do we want to make sure that we're catching those cases where the B12 in our diet is inadequate, but maybe our liver is outputting a little bit of B12, and so it's covering up this insufficiency in our diet, but we're still seeing the side effects. So who's at risk for this? I mentioned older adults. That is a really big concern for people who are older. Diet and GI changes, our inability to absorb and process B12 really gets affected as we age. So if you're a bit older and you might be experiencing some of those symptoms, it's a really good idea to do one of our B12 tests and see if that could be the cause of some of those symptoms. So older adults for sure. And this again is because of dietary changes, but also some of those absorptive changes. There are a lot of things. Our saliva amount goes down as we get older. Some of the enzymes required for conversion of B12 to metabolically active forms can change as we get older. So it's important for that to be considered for older adults. Mentioned pregnancy and breastfeeding women. When you are pregnant and breastfeeding, your body is prioritizing the fetus, prioritizing your baby, prioritizing making that breast milk. And so your body will have higher nutrient needs just in general. But also your body is really sacrificing a lot of those nutrients for baby, whether you're pregnant or breastfeeding. So people who are pregnant and breastfeeding are at a much higher risk for having insufficient intakes of vitamin B12. Also considering a lot of food aversions during pregnancy as well. You can see food aversions, especially to things like meat and animal products early on in pregnancy, where B12 is extremely, extremely important for preventing those neural tube defects. And then, as I said, when it comes to infertility, making sure that you're having adequate B12 levels as well. Vegans and vegetarians. I mentioned that vitamin B12 is primarily found in animal products. Well, if you are a vegan and you're not eating any animal products, you have to take a B12 supplement, and highly, highly, highly recommend getting that B12 level check fairly frequently and regularly as well too, to make sure that your supplement is doing what you need it to do and that you're getting those adequate B12 levels. Vegans absolutely need to be monitoring their vitamin B12. Vegetarians as well, because you're not getting those meat sources. If you do eat other animal products though, like eggs or maybe cheese, you might be getting some vitamin B12, but it may not be enough. So also recommend, if you're a vegetarian, especially if you're a long-term vegetarian, you've been so for a long time, it's a really good idea to check and monitor your B12. Also, anybody with chronic GI dysfunction. So this can really be a range of conditions, but anything having to do with your small intestine and your stomach specifically, but also large intestine. So anything that's going to affect digestion and absorption, I highly, highly recommend getting your B12 levels checked. Things like gastritis, Crohn's disease, IBS, they can all affect your body's ability to break down that or to perform those reactions that are necessary for absorbing B12, but they also can affect that absorption ability. B12 can pass right through your system or be inefficiently absorbed. If you've had a previous weight loss surgery, specifically a Roux-en-Y or any kind of bypass, it's really, really important to have your B12 levels measured. If you have any family history of megaloblastic anemia or pernicious anemia, if anyone in your family, a grandparent, parent, anybody like that has had those conditions, you are more likely to develop that later on in life. So I definitely recommend, if you've had any family history of those things, to get check and monitor your B12 levels. Anyone with any autoimmune conditions, these are inflammatory conditions that can affect all different levels and layers of our absorption and processing of vitamins and minerals. So it is extremely important for anyone with an autoimmune condition to get their B12 levels checked and assessed. These are people most at risk for a B12 deficiency or insufficiency, but I really think because of the complexity of vitamin B12 digestion and absorption, it's really great for anybody to check and monitor. And especially because we need to get it through our diet, and our diet can fluctuate so much. really anyone can benefit from getting their B12 measured, but if you fall in any of these categories, you should really be measuring and remeasuring and monitoring your B12 as much as possible. And of course, as always, please talk to your medical provider before making any changes. When you're discussing your results, I highly recommend discussing them with a medical provider and before making any dietary or supplement changes as well too. So moving on to the different types of tests. So a serum B12 test is just that. We're testing the serum level in your blood of B12 levels. And because a significant portion of serum B12 is bound in the liver and will be stored in the liver, it's not really available to be used by the body. So serum B12 is used most often by clinicians, but it misses a lot of those kind of borderline cases and people who are insufficient, but not quite to that deficiency level. And so they're not getting enough in their diet, and a lot of their B12 is bound up. So we're not getting an accurate picture of the status of B12 in their diet. So with, and again, these subclinical cobalamin deficiencies, we're seeing those serum tests come back in that low normal range. So you may be somewhere between like 300, 350, maybe up to 400. But you're not having those clinical symptoms yet. Or maybe you do have some of the clinical symptoms, but your serum tests are coming back in that low normal range. And whoever is interpreting their test says, well, you're within normal. So I don't think that's it. And so this is where we want to, look for a different test. So here at OmegaQuant, we recognized this problem and we wanted to do something that was going to be a little bit more, a lot more accurate and effective for people who kind of they're not quite in that emergency state of, a true deficiency yet, but is accurate for anybody, but will hopefully catch a lot of those folks who are borderline. So what we are doing is a urinary MMA or methylmalonic acid test and creatinine ratio. So MMA is a byproduct of B12 metabolism. Well, it's a byproduct of, it builds up when in the blood and in the urine when B12 is not present. So a B12 inadequacy leads to the accumulation of methylmalonic acid, okay? A serum MMA, so if we checked that same product in the blood, can be affected by a lot of other conditions. So intravascular volume depletion, so if you're really dehydrated, pregnancy, where you can have a volume increase but blood dilution, and things like SIBO or small intestinal bacterial overgrowth can all affect MMA levels in the blood. Also, serum MMA is a really high cost test and it's a really slow turnaround time. So we didn't want to go through this route. It is something that can be useful, but it was something that we didn't feel was useful to most people and not going to be the most accurate, because if it's affected by so many of these other conditions, we want something that's a bit more accurate. So what we have now is a urinary MMA and creatinine ratio. So urinary MMA is the excretion of that methylmalonic acid that builds up when B12 in the diet is insufficient, okay? And we use creatinine as a corrector, as a ratio corrector to correct for kidney function. So we're not seeing someone with a kidney disease that has maybe super concentrated urine or not concentrated urine, depending on what the disease we're looking at is, and we're correcting it for creatinine. uMMA, so that urinary methylmalonic acid, is more stable and more specific than either a serum MMA or a serum B12, a serum cobalamin level, especially when corrected for creatinine. So we're seeing something that's stable. It's not going to go up and down if you just had, ate some chicken. Your B12 level, your MMA level isn't going to shoot up. Or your MMA level wouldn't shoot down in response to just one meal. And it's specific in that it's not going to be affected by all these other conditions, right? It is really specific for B12 here. It only requires a small amount of urine. And uMMA is great because it will remain elevated and until treated with B12 specifically, okay? So this is the test we've developed, or we are using now here at OmegaQuant, is our uMMA test to test for vitamin B12 deficiency and insufficiency. So what are the normative values for uMMA? So our desirable range for our uMMA creatinine ratio is 0.3 to 2 millimoles per mole of creatinine, okay? That is what our desirable ideal range is. And the reason for that is the cutoff there is it is believed that we can start to see some of those symptoms and some of those insufficiencies once you start getting over that 2 millimoles. The reference range is up to 3.6 millimoles, and that's where above that level is when we get into that dangerous territory, and that's where neuronal activity can be seen. That's where impairment of neurons, potentially some of those cognitive effects. You can even start to see some of those anemias once you get above those levels for a long enough period of time. So for us and for our test, for our urinary MMA and creatinine ratio, we like to see between a 0.3 and 2 millimoles per mole of creatinine. And this is what your report would look like when you received one of our tests. This is the range you would have, and your number would be in this nice little circle here, and it would tell you what your levels are. So just a little bit of kind of nerdy lab stuff as far as stability. So we'll talk about how you will collect your samples for this test, but stability for time and temperature, because we are a lab where you're going to be sending your samples through the mail, we want to make sure that these samples are going to be safe, and that when we are measuring it here at our lab, you are going to be getting the most accurate representation. So our collection system is stable through time and temperature for quite a long period of time, for at least 28 days. So if you take that sample and send it off to our lab, it will get to us well within that period of time and be analyzed, for your uMMA. So that stability is there and will last quite a long time. So you can feel safe that you're sending your sample off, and it will remain an accurate measurement when you receive it. So this is our, just again, a little bit of nerdy lab stuff, our coefficients of variability showing that our lab tests are excellent repeatability. So we are accurate and repeatable. So talking about treatments for low B12 levels. So what do you do if you get your urinary MMA and creatinine back and you realize, oh my gosh, it's lower than I'd like it to, or higher than I'd like it to be. So your uMMA and creatinine would be high, which higher than our reference range, or on the high end of that. And that would indicate a low B12 intake, okay? So how do we increase our intakes of vitamin B12? So the first one is increase intakes of vitamin B12 containing foods, either natural or fortified. There are a lot of fortified foods out there now. This is most effective for people whose cause of low intakes is low B12 intake. So not those with absorption issues. If you have, let's say you've had a Roux-en-Y gut, gastric bypass, or you have like a gastritis or some other malabsorptive condition in your GI tract, this would probably not be the best way. But again, always please talk to your healthcare providers. This is not medical advice. Supplements for the next step would be a supplement. Supplements doses range from 20 to 1,000 micrograms for B12. Absorption at those higher doses isn't so great because you're just throwing a lot of B12 into the stomach, and we don't have enough of intrinsic factor and all the other cofactors in order to absorb the B12 that we're throwing in there. So supplements can be useful, but the absorption at those higher doses isn't so great. And the final step would be injections. So again, please talk to a healthcare provider. This is not medical advice. There are B12 injections available by prescription from a doctor. And so this would be most effective for those who have really those severe deficiencies, and because it bypasses that absorption issues in the GI tract. So talk to your doctor, talk to your medical provider if you are on that higher end, and talk about those options for you. Okay, we want to make sure that everybody is getting what they need and is discussing this with their healthcare provider. So dietary sources of vitamin B12. As I said, it's almost all going to be animal products except for some of those fortified foods. So really high sources of B12 would be fish. So believe it or not, oysters, clams, tuna, scallops, they are all really, really high in vitamin B12. So if you can eat seafood more often, we talk a lot about seafood here at OmegaQuant, because of our omega-3 index and trying to get more of those omega-3 fats in. Just one more reason to include more seafood in your diet. And seafood that isn't necessarily high in omega-3s may also have some vitamin B12. So a variety of seafood is really, really good to include in your diet. Meats, particularly organ meat has a really, really, really high amount of vitamin B12 in it. But any meat really is going to have a good amount of B12 in it as well too. Eggs are a good source. Dairy products are a good source as well. And then some foods are fortified with vitamin B12. So things like breakfast cereals, a lot of breakfast cereals are fortified with kind of a range of vitamins and minerals, B12 being one of them. Plant milks, so your almond milks, your oat milks, those types of things. Some of them are fortified, not all of them. Same thing with cereals, not all cereal is fortified. Some are. And so you just want to make sure you're taking a look at those labels and see, is it fortified or is it not? It just depends on the brand, depends on the type of cereal. A lot of organic brands are not fortified, so you just want to take a look at that if that's something that you're looking for. Tofu is often fortified with vitamin B12. And then fruit juices as well too. A good number of fruit juices are fortified. So if you're maybe, wanting to get it in for a kiddo, or this is just a way that you want to get a quick bit of B12 in, fruit juice can be another way of doing that. So a little bit about our test specifically. I talked about how this is our only urinary based test at this point. And it's really, really simple to do, and how to do this. There is a small little collection kit, a little tube. The first thing you're going to do is make sure that you register your kit at OmegaQuant.com, using the unique barcode that is located on our on your test kit. If you don't register that, you're not going to get your results. So you really want to make sure that you're registering that, before you go ahead and do your collection. The collection is in our little tube called the Colli-P device. There's a little kind of funnel device there that connects up to the tube. It's super simple. It's easy to use. You dispose of the parts you don't need, put the cap on, put it into the provided envelope, and send it off to us. And like we said, it goes through the mail. But our test is the product, and the Colli-P device are stable at time and temperature, so no issues with sending that through the mail safely to us. So ordering kits, this is how you order any of our kits, but specifically if you want to do the OmegaQuant or the uMMA kit, you just go ahead to OmegaQuant.com/shop and order one of our take-home test kits. Again, on our website, it's labeled both vitamin B12 and uMMA or the creatinine ratio, so you know exactly which one you're getting. Make sure you register that kit. Collect your sample. Most of our tests are blood samples. This is our only urine test kit, so just know that this is a urine collection, and simple and easy to do. Mail that sample back, and within about 2 weeks, you'll get results. They will be sent to you through your email, but they'll also be accessible through our web portal. Really, really easy to do. And you get a full printout of kind of an explainer of your results, kind of some helpful hints on things that might need to do to improve your levels if they need to be improved. And if those levels are looking good, monitor every, couple of months, or, once a year if you're really feeling good about your diet and things are, how things are going. And that's all there is to it. Thank you so much for hanging out with me today. And that was vitamin B12.